First thing that we're going to do is cover the surface area of the heart. The heart is made up of 4 chambers: the right atrium and the right ventricle, the left atrium and the left ventricle. The left ventricle is distinguished by the fact that it makes up the apex of the heart down over here. The base of the heart is up here. Okay, these 2 structures here are parts of the atria. They're known as the right auricle and the left auricle. The major vessels of the heart are the superior vena cava. These 2 vessels here are the brachiocephalic veins that go into the superior vena cava. This structure we'll talk again about later. This is the pacemaker of the heart, the SA node. Also going into the right atrium is the inferior vena cava. And later on we'll see the 3rd vessel that goes into the right atrium, the coronary sinus. So we have the superior vena cava and the inferior vena cava going into the right atrium. Coming out of the right ventricle, we have the pulmonary trunk, which if you follow the pulmonary trunk up, you'll see it branches off into the left pulmonary artery that goes into the left lung, and on the other side, the right pulmonary arteries that go to the right lungs. You'll notice that their color is blue. That's because they're carrying deoxygenated blood. The right side of the heart always has deoxygenated blood. This structure over here that connects the pulmonary trunk with the arch of the aorta is the ligamentum arteriosum, which is basically a remnant of the fetal circulation, which in the fetus it was a shunt between the pulmonary trunk and the arch of the aorta that shunted blood and was known as the ductus arteriosus. Continuing with the vessels, the pulmonary arteries go to the heart, go to the lungs, where they pick up oxygen, and they come back from the lungs through the pulmonary veins, the left pulmonary veins on that side, and the right pulmonary veins on this side. Okay, they go back to the left atrium. Blood then goes to the left ventricle, and it continues out of the left ventricle through the ascending aorta. It then continues into the arch of the aorta, and its 3 major branches are the brachiocephalic trunk, or the innominate artery, the left common carotid artery, and the left subclavian artery. The arch eventually becomes the descending aorta, which is the thoracic descending aorta, above the diaphragm, and below the diaphragm, the abdominal descending aorta. This structure here is the trachea, which branches off into your left and right bronchi that go into the lungs. And that's the surface anatomy of the heart.